Hey, what's up, guys? Just want to give an update on my left wrist. So, it's been about 9 months now. This is my wrist that I had surgery with. That's the scar. And my grip strength, I have to say, is probably, I'd say almost 100%. I would say. I went back to weightlifting, so I can actually say my left hand, which is funny, is actually stronger than my right. I don't know if it's because of maybe it was just simply uneven at the beginning, but yeah, definitely did get my grip strength back. As far as flexibility, this is pretty much moving side to side. I don't have too much motion there. It doesn't bother me too much. It's more when, this is pretty much when I'm pulling my wrist down. As you can see, it's pretty good, actually. Not really too bad. I would argue that it's almost quite normal. And then when I go all the way back, that's my motion. And that's where I'm at right now. Not too bad. Actually, my physical therapist was kind of surprised of how much mobility I have. So thankfully, that I got a lot of mobility and grip strength, because proximal row complectomy, I think that's what it's called, or PRC. It's a very savage procedure since it does remove 3 bones from the left wrist. But, really happy that, I know I've got some scratches on my floor. Oh well. But really happy that everything seems to be good. I have the mobility that I need every day. 95% of what I do, I pretty much, I could do pretty much 95% of everything. Work, not a problem. Work is, I fix a lot of small things, so definitely I don't have any issues. Maybe if I did labor work, it might impose issues. I would have probably have gone in a 4-corner fusion if I was doing something like labor work, since 4-corner fusions, they technically or theoretically are supposed to be more stable since bones are fused together or whatnot. But I'm very satisfied with this procedure. If anyone is in the fence with this, like maybe you're debating on a full wrist replacement, 4-corner fusion, or the one I got, PRC. Really just do a lot of your research. I can't really give out medical advice. I had to weigh down the pros and cons, because I understand from my surgery that I got, I'm more prone to getting arthritis, and arthritis already kind of runs in my family. So I'm probably more than likely will get it. I do want to minimize it, like extend it until I do get it. But nonetheless, I'm very satisfied with this. And if you're gonna, from what I heard, if you want mobility, you definitely want the PRC procedure. But if you want more grip strength or stability, I believe the more likelihood is a 4-corner fusion. My doctor, the orthopedic that worked on my hand, he did tell me that for my condition, like if I were to get arthritis, he says a lot of his patients don't feel too much pain on it. So he told me that it's not a big issue, but he did say if it does become a huge issue, then they would do probably like a wrist replacement. I can do push-ups with this hand, but it does kind of hurt. a tiny bit. I feel like I could get used to it, but I choose not to, since I really don't want to overwork this or injure or re-injure myself, because that's the last thing I want to do. Just taking care of it, not doing something too crazy, you know. So definitely was worth it, you know. Definitely was worth it. But like I said, I'm not a medical professional. I don't know any medical advice at all. So it's just what I'm saying is very just on my perspective. Do your research. Always do your research. Look at the statistics. Go to .gov sites. Look at the abstract, the data, and see if it's something that you want to risk. Because every surgery, there's always going to be a risk. But, you know, it depends on if you want to take that risk or not. For me, I was definitely going to take the risk, since I couldn't live with how my wrist was kind of popping out of the joint all the time. So this was definitely worth the risk, if you ask me. Very satisfied, you know. Can pretty much go almost all the way down. I did, my doctor did tell me that I'm about 65 degrees when I go up, almost 70. And when I go down, I forgot, actually. Not too sure. But yeah, it's almost normal, because I know the normal is 72 degrees going back, but I'm just slightly below normal. But, you know, just pray, hope for the best. I hope you guys can, you know, find what you guys are looking for. You know, just do a lot of research. Get a second opinion, third opinion, fourth opinion. And I didn't take the surgery until I got like a seventh opinion. Because every time I went to doctors, some doctors, it didn't seem right. Or I didn't trust the orthopedic. So I was, you know, just always get other perspectives on things. It's very good, because sometimes, definitely in the medical field, doctors know somewhat of another doctor, especially if, like, they're orthopedics, you know, they're in their field. They might, you know, say, oh, that guy hasn't done a good job or something, which though it actually happened to me. That's why I backed out on a surgery at one point. But yeah, like, comment, subscribe, do what you want to do. Probably won't post too many videos or give too many updates after this. This is pretty much almost a finalized kind of thing. If you guys want to look at my other wrists, this is the other one. Obviously, this is 100%, you know, don't have issues. Rest in peace to the 3 bones that were lost. Alright, take care, guys. Bye.